Want to get the record button started? Okay, Jeff, it's recording, so we're up and ready. Did you want to make any introductory remarks?
Just that everybody's seen the videos we've been putting out, and I attended this webinar or a similar webinar last week, and it was very important, I thought, for the people that work with Better Business Planning to see this, because these are the questions that everybody's going to start to try and figure out answers to, and a lot of the information is very vague and gray, and you did a great job of putting in the right direction. And I know you have a great program for people that are looking for answers to this. So I'll let you take it from here, and I'll listen as well.
Great, I appreciate it. Thanks, Jeff. So my name's Steve Jordan. I'm the founder of Traiden Global Solutions. I've been in this industry since 1974. So for those of you with calculators, you can figure out how old I am. But this is our sixth pandemic event that we've had as Traiden Global Solutions. First ones were back in 2002, but we've been associated with pandemic events since the beginning of my career. And if you think about pandemics, they have been around forever. They were leprosy, polio, tuberculosis, chickenpox, malaria. There's just a wide range of these things. It was the Black Plague, the Spanish flu. There has been quite a few, and we've had six since 2002, including the H5N1, which was the avian flu, SARS, MERS, two other coronaviruses, the swine flu. This is not something unusual. And so when we hear people that said, well, we predicted this coming, that wasn't a hard prediction. That was a very simple prediction. Of course it's coming. It's been plaguing the world since the beginning of time. And so we run into these things that we don't know what they are, and we don't know how to define them. But for the most part, this is a flu. What makes it different is a flu we have no immunities to. And so in some ways, we treat our company, the way that the company treats this as an illness is like a flu. And in other ways, because of the fact that it's been declared a pandemic, we look at it in a different aspect, and it can affect things like workman's comp, or the way that we have to report things to OSHA, or the way that we have to record. So let's take a look at a couple of issues, and I'm going to give you some direction on where I think you need to go towards the end of these slides. When I worked in nuclear power, we had two highly technical terms that we used. We call it schmutzy. The schmutzy was all the things that we couldn't define, and zoomies were all the things that made us duck. And every time, there would be times when an alarm would go off in the reactor room, we'd look at the reactor and think, now, what is it doing now? And so on occasion, we'd have to hit the I believe, and we would just say, well, there's schmutzies and zoomies floating around in the reactor somewhere. That probably doesn't give you a whole sense of security about nuclear power, but it is. It's sometimes that the chemistry just changes. Well, we have the same thing in other industries. For example, in petrochemical, we have hydrogen sulfides that at 300 parts per million is lethal. In mining industry, which I work a lot in, we have cyanide, we have caustic acid, we have ammonia, we use hydrofluoric acid. There's some kind of methyl ethyl schmutzy in a lot of different industries. And what we've done over time is learn how to work around those by using protective measures. And we continue the industry. We don't shut everything down. Well, in this case, it's taken us a while to kind of figure out what we're up against, what we need to do next. But we're in this point now of recovery, and the point of recovery is to find a way to live within where we are right now. So we're all driving towards a vaccine. Once the vaccine's in place, it'll take its place with the other pandemics that we've had in the past. So we still take a vaccine every time you get a flu shot every year. You're getting a little bit of a viral load for the avian flu and for the swine flu and for MERS and SARS, all those other things that we had in the past that we had no immunities to. That's why I always encourage people that if you get the opportunity to take the flu shot, take it, because there are still things out there that you don't have immunities to. And we still have people that die every year from the swine flu, and that's been 17 years ago. So there are things for us there is a way for us to live as a society with the dangers that are around us. I often say that safety is not the absence of danger. You can't make all the danger go away. So safety is not the absence of danger. It's the presence of preparedness, and that's what we need to be now, is prepared. So what did we do? Well, when it all hit, nobody knew what to do, so we said, everybody go home. will work from home. And that created its own problems itself. Now, the picture you see here is not my office. I've been doing this for a long time. I've been doing this since the early 90s, working from home. And it's a disciplined action. It's something that you learn over time on how do you stay efficient? How do you make sure that you work the hours you're supposed to work, that you don't end up putting in 16 and 20-hour days, or that you don't find yourself putting in short days. So the pitfalls that we have of sending everybody home is that we didn't have any dedicated office space. So a lot of people don't have an office set up, especially I'm sure they don't have one like I have set up. And they, they might be working from a kitchen table for a countertop or from a bedroom, but uh, they're not set up. They don't have a dedicated office, and they don't have ground rules. Their family doesn't understand what it's like to have mom or dad or anybody home, or their friends who just think it's okay to drop by because they're home. We have household chores, and then there's a discipline of making sure that we don't tip into the liquor cabinet. So it's so especially now, while there's a lot of angst and a lot of confusion, a lot of frustration, a lot of depression, this is a difficult time to put people, lock them up in their home. It's what I call in this the dungeon effect, is we feel like we're trapped. So we also didn't put the right technology into place, and so we have these people that start late, they end early, and our productivity rates go down. So if we have a company, our optimum statistically, our optimum performance rate of any one employee should be 88% of productivity in a day. That's what we're hoping to hit. So when we sent everybody home, what happened? Well, our productive rate in all of our businesses started to decline. And so instead of being at 88%, we probably initially dropped down to 80. And we may have even dropped way beyond that, down into the 50s and 60% productivity rate out of people that we sent home to work, mainly because we didn't tell them how to do it. And so a part of what we're going to do in this process is we're going to say, for those of you that are still working, that are in essential services, that still have a business that's up and running, or that you're partially running, or you're still trying to maintain something that looks like a business from home, this is the time where we're going to gather up everything that we're doing right now, and we're going to establish the new normal. Now, nobody likes the new normal. Everybody hates the word. Everybody wants to go back and do it the way they used to do it. Well, things have changed, and they've changed not just because of COVID-19, but they've changed because of the way we're doing things at the federal, state, the county, the city, and even in some specific types of industry. We've been given all of these guidelines about how we're supposed to do this, and it gets confusing. So let me get this, there's a tremendous delay in just for everybody's, the internet runs slow, these Zooms are running slow, everything's running slow, so please bear with us. Sometimes the slide will show up about 5 seconds after I'm in the middle of it, but just be patient, things will move through. So what happens to us if they open up everything today? They say everything's open, everybody can come back next Monday. What happens if everybody just returns to work next Monday at 8 o'clock? Well, depending on where you are in your business, if you're an essential service and you've continued on, does it mean that you just continue on with what you're doing? Kind of yes and no. If you've been in a modified situation, can you just bring everybody back in and start again? No. Does it mean that the COVID's over? No. Does it mean that for those of us who have had to shut down for one reason or another, that we are prepared to go back? The answer is no. So there's more no's than there are yeses. So let's think about a logical way of which we can return to work without performing the fatal function of starting back at ground zero. We always want to make sure we're moving forward and that we don't result back to ground zero. So there's a lot of things that could happen. Is the building ready? Is the equipment ready? The workplace ready? Do we have jobs assignments? Are our suppliers still up and running? Are our subcontractors at the same pace that we are? Do we have new policies and procedures in place? What is the health of our workforce? Is everybody healthy? Is anybody exposed? Has anybody had it? Where are we, and what do we do with all of that information, and how do we set ourselves up? And that is the purpose of this webinar. So like I said, we have a lot of guidelines. Everybody has an idea. Everybody tells you the same thing: wash your hands. Well, I've been washing my hands for nearly 65 years, and I'm pretty sure I'm getting pretty good at it. So, and I wash my hands quite often because I've been out around the schmutzies and zoomies, and I know what happens if you don't take care of yourself. So it's been something that's been a regimen of mine, but it is something we need to continuously remind people. Sneeze into your sleeve. Sister Mary Knickknack in my parochial school taught us to do that. Sneeze into a napkin, sneeze into your sleeve. So these things that we think are common sense, and then we tell people wear a face cover. This is where things start to go south. It amazes me to look out into the public realm and see a family of 4 walking down the street. 2 have on a mask, 2 don't have on a mask. And I often wonder, why do 2 have a face shield and 2 don't? So I've asked a couple of people on occasion, I've said, why is it that you have masks on, but your children don't? Or why do your children have on masks, but you don't? And oftentimes I get this answer, well, they're the vulnerable population. We want to make sure that they don't get sick. So that makes no sense to me whatsoever. Why is it a couple walks down the street, one person has on a mask, the other one doesn't? Well, I've asked that question too, and it's, well, my wife has COPD. So the thing that amazes me is that they become somebody who can be infected. The one without the mask can be infected by that, and then they become the pathogen by which they pass it to the other person. So when you're out in public and you've collected up this virus spore and it's now in your system, you start showing signs. As soon as that person that you've been out walking with takes off their mask, you become the pathogen to infect them. So there's things that don't seem to make sense. And so when we look at why um, in some of the states, I see that Governor Newsom in California has extended the uh, the shelter in place till May 22nd. Other people are trying to figure out where they're going to go with it. Some are looking at opening up today. Some are looking at what can we do to open up in the next few days. And so we have what we call this opening up America again. It's the plan that came out of Washington, D.C. And like all the other guidelines, they're incredibly vague. So, for example, in this, for all phases and for employers and individuals and specialty, they tell you to do 3 things. They tell you that the guideline for all of those phases, we want you to implement appropriate policies. We want you to monitor your workforce, and they're going to develop and implement policies to trace what's going on with the COVID-19, especially in the test field. So, if it's required to be done at the federal, state, city, or county or city level, you should adopt that inside of your own company as well. So if they have to do it, you should think to yourself that you need to do it as well. You need to put together appropriate policies. We need to monitor the workforce, and we need to continue on. Now, things are very vague. They say, well, here's phase 1, is that if we see the gateway where we see that there's a decline in the number of COVID positives, a decline in the death rate, we have all these little indicators that we hang on to, and we say, if we see that, then we can go to the next phase. Well, I'll tell you what's going to happen. As soon as we put all these people from phase 1 and we put everybody and we mix them back in, we're going to see the numbers go up. It's just the way it works. We flatten the curve so that the medical society could get ahead of this. It's not so that we could get this thing down to 0. It's so part of the decision for how long we're going to stay open has 2 factors. One is, are the people complying? And number 2 is, are we, from a medical standpoint or from emergency management standpoint, are we ready to tackle what's coming next? And so we're getting closer and closer to this point, but it becomes incredibly important for us to continue on in our effort to, as a community and as a nation, to continue to work to control this COVID-19. Until we get to that spot of the vaccine, this is incredibly important. So in the guideline for phase 1, they tell us that we're going to continue to work from home. If that's the case, we better start training our people how to do that. We're going to return to work in phases, and that's exactly what we're going to talk about at the end of this this presentation. Is I'm going to give you some recommendations on how to prepare yourself to return to work in phases. We're going to keep our common areas closed, non-essential travel. Now, that's not the travel to New York or Las Vegas or to San Francisco on business. This is your essential travel, even inside of your own business realm, inside of the footprint that your business operates. Now, when I'm going to talk about the business footprint throughout this slide or throughout this presentation, the footprint is this: is if you have an office, you have a yard, you send service trucks out, wherever you go, wherever your vehicles go, wherever your service people go, wherever you inhabit, that is your footprint, and that is what you're going to be responsible for. And we'll talk about the guidelines that look more like regulations in just a second. The last one, I'm only going to mention this one, is I'm part of this, what they call the vulnerable population. And they say, well, anybody over 55 or 60 or um, that's the vulnerable population. They need to have special accommodations. Well, that's a hard thing to do in a situation like this where we have no policies and procedures. So I live in a 55 and older community. We are the land of the blue hairs, gray hairs, and no hairs. And there's a lot of people that live here that still rely on going to work to survive. But yet, when I look around the neighborhood, these are the people that were told not to come back to work because they're vulnerable. These are the people that were laid off first. These are the people that were furloughed first. And so we're standing around waiting in hopes that something's going to come back so that a lot of the people in my community can go back to work. Uh, it, so all I'm going to ask you is pay attention to that. If you have somebody that fits in that vulnerable population and you're afraid to bring them back in the workplace, please try and find something for them to do to be productive. And that's all I'm going to say on that. Phase 2, we should just start dropping things off. We drop off the whole idea of returning to work in phases. Now we can start doing a little bit more freer travel. And then when we get on to phase 3, it's unrestricted staffing of work sites. But every time that we get to the next phase, there's a gateway that says that we need to accomplish X, Y, and Z. So we get into phase 1, we're going to see that the COVID-19 starts to climb. Hopefully we start to see it declining and it's not completely out of control, or we find that we have a vaccine and we have a better system of treating people in the hospital, and then we can move on. And then we'll move to the next phases. Then finally we get to the spot where we're back to what we think is the new set of normal. But new normal is not going to be the old normal. It's just not. These things, if you look at it back historically, these things change. So last Wednesday, not this Wednesday, a week ago Wednesday, excuse me, OSHA came out with a guideline. Now, and the guideline is a publication, so it's publication OSHA 3990.03, and I'll make that available to you. But if you want to look it up, it's OSHA 3990.03, and it's the guideline on preparing the workplaces for COVID-19. Now, again, there's a lot of information in there. It's a guideline. It tells you what they want you to do, but it doesn't tell you how to get it done. But some of the things that are in there is a requirement for an infectious disease response plan and the establishment of a competent person for implementation of that. Now, you have to understand OSHA and how they work to understand these guidelines. So right on the first page, it says this is not a standard or a regulation. It is a recommended guideline and not enforceable. Now, when we think about that, let me explain what that means. So in order to establish a guideline and convert it into a standard or a regulation, sometimes takes years. It needs to go to committee. It has to go out to the industry. It gets redlined. It gets marked up. It gets changed. They decide what the penalties are going to be, what the benchmarks for assessment are going to be, and then it gets released as a standard or a regulation. So it's impossible to put a guideline together and have it released as a standard or a regulation. It does not mean that the guideline is not a requirement. And so in there, it says that everybody needs to have an infectious disease response plan. And Jeff, I sent to you a pandemic response plan that in the interim time, if you want to make that available to all of your clients, that will suffice for right now. It's a long, lengthy document. We're going to continue to upgrade it and update it as this moves along, but that is available to you right now. The competent person needs to be somebody who's actually read through it and understands what's in it. And the competent person, although it's not specified in the guideline, is assumed under OSHA that anytime that there's a guideline, that there would be a competent person that puts it into place. So we can help you with this guidance with these programs. So it's not a standard, it's not a regulation, so it's not enforceable. Well, that's not exactly true. So we also have in the OSHA world something we call the general duty clause. Now, the general duty clause requires all employers to develop and maintain a safe and secure workplace for their employees. It needs to be free from recognized hazards that are causing or are likely to cause death or serious physical harm. And that includes infectious diseases. So a general duty clause is basically this: if there's not a standard and there's not a regulation, but it can be shown to be a safety issue and a safety item that is just not standardized or regulated yet, it falls under the general duty clause, and you can be cited against the general duty clause. And oftentimes people are. In fact, you get cited sometimes against the general duty clause more than in other situations. So what they said is that this is not a standard, it's not a regulation, but on that same page, it says all aspects of the general duty clause apply, which means that if they say put an infectious control disease control plan in place before you get into phase one, that's exactly what they mean. And if you need to get a competent person in place, that's exactly what they're asking you for. So there's no ambiguity in this. It's get the plan in place. So we have a plan for you. We can help you with the competent person. In some situations with small companies, we become that competent person to help them implement the program. But we can have those discussions sometime later on. So now we're getting down to meats and potatoes. These are you're going to get this slide deck, so I want you to pay attention to it, because when we get to the end and we get to the step one, we're going to apply these things in step one. So the hierarchy of controls has been around for a long time. We use it when we do our business impact analysis. And a business impact analysis is something that every industry, every company should do, whether you're a company of two, which is our smallest company has 2 people. Our largest company has 105,000. So we do everything in between. And we encourage you to do a business impact analysis. It actually should be part of your business plan. And what we do is we say that given the type of work we do, what are the hazards? Now, we think of COVID-19 as a hazard. Well, so is workplace violence, so is loss of utilities, so is the loss of a key personnel, so is cybersecurity, natural disasters. All of those things can affect the workplace. And we have a slide on that a little deeper in the deck, but we'll talk about it more specifically. So keep that in mind. But elimination is basically we physically remove the hazard. Substitution, we replace the hazard. In this situation, we can't. Engineering controls isolate the people from the hazard. Administratively, we change the way people work. And personal protective equipment is that we protect the workers from the hazard. So we look at the hazard. We determine the probability of it occurring in our facility. We look at the consequences if it does. We build a strategy, and then we build a tactic. And the strategy is what we're going to do, the tactics, how we're going to do it. But we use this hierarchy of control in establishing what those strategies and tactics are supposed to be. It's not as difficult as it seems. It is incredibly simple, and I'll give you some tricks on how to do that. So in the event of this COVID-19 elimination, the way we eliminate the COVID-19 in the workplace is through personal hygiene, stay-at-home policies, and work from home. If people who are potential pathogens don't get into the workplace, then we don't bring the virus into the workplace. If we maintain our personal hygiene and we stay safe and we shelter our place when we're at home, do social distancing on our off hours, then that is one way that we eliminate the possibility of bringing it in. Some of these we can control, some of them we can't control. Substitution. Now, there's no way to substitute. This is just, it's a part of what we live with right now. It's not like taking a ethanol-based sanitizer, which seems to be the buzz right now, and replacing it with something that is a little bit more eco-friendly, that doesn't require the same type of PPE. So we can substitute different things that we use in combating the COVID-19. Respirators is another one that we can do in substitutions. Cleaning supplies, hand sanitizers, we can change those types of things, but those are tools to combat it. It doesn't eliminate the hazard, so the hazard's still there. Engineering controls. A lot of you work in buildings, and you have buildings with property, or you have buildings with a yard, or maybe you just occupy a space in an office. Maybe most of what you do is from home and everything else that you do is out in the field. So if you lease or rent or you own property and you've now been out of that, or you have not fully occupied it in the last, or just partially occupied it in the last 2 months or however long it's been, there's certain things about that building that you need to check out. What are the gremlins that are in there? Now, what things can we do? Can we install a different type of filter system in the HVACs? so that we have a smaller micron filter that will help us out in circulation. We have found that the HVAC system seems to be a pathogen by which pathogen is just how we transfer the disease from one place to the other. But it may be that the HVAC system is what moves things throughout an office complex. So it doesn't make any difference if you put people 6 feet away. If you're blowing the spore all over the office space, it's kind of a moot point how far you put people away. We might be able to change the exchange rate. Now, the exchange rate of air is simple, and whoever does your building maintenance will understand that. Is there's two different ways that we control airflow. Is we say that if our exchange rate is 7 or 8, that means that all of the air that's in a particular enclosed area cycles through the HVAC system 7 or 8 times every hour. Well, we might need to push that up to 15. So we get 15 exchanges every hour so that we keep the air a little bit purer and cleaner. It means a little bit more changing in the filter, but at least we're up and running. We may also look at positive pressure versus negative pressure. Sometimes that's just a damper change or a redirection of a motor. And positive pressure means that we blow something into a room. Negative pressure means that we suck things out of a room. So we need to also redesign the workspace area. So I stand 6'2". If I stretch my fingers out tip to tip, I am 6'2". It's the way we're constructed. So if you're 5'10" and you stretch your fingertips out, you're 5'10" across. So you can use that as a simple measuring stick that says, am I 6 feet away from where somebody else? But the workspace area is not just about moving people. We can also install physical barriers. So if your office space is maxed out right now, how are you going to take everybody out or get that workspace where everybody's 6 feet apart? Well, we work with a company now that uses visqueen and different types of 20 mil plastics, and we can build screens and frames that we can use as physical barriers. Remember, we're not trying to build a cage that we're going to survive in the rest of our lives. We're building a system that is going to help us, number one, comply. Number two, make sure that we don't go back to ground zero. And more importantly, that we protect our employees during this time. Once we get this thing under control and there's vaccines in place, then this is going to fit in again into line with all the other flu types and influenzas and things we've had in the past. And we're going to find ways to deal with it. Also, we need to create drive-up services. Now, this is not, don't think of the drive-up service like the drive-up window at McDonald's. So we get somebody who comes in and delivers water. Sparkless guy comes in, he takes 12 bottles of water, he puts them on a cart. He goes in through the lobby of the facility. He goes to the right, he goes down the hallway. He's got 12 different offices and open spaces that he moves through with his bottles, and he loads the bottles up. And then he goes and he finds a person to sign off his invoices. Then he takes the path out and he goes back out through the lobby again. That is a workflow. And workflows can be very dangerous, especially if the people that are part of the workflow in your facility are not people that you can control. You have no idea if that guy who delivers the water has a COVID-19 policy and program, if he wears a mask, if he's contaminated, if he uses glove, if he wipes down his equipment. You have no idea. You have no control of that. But you can have that same Sparklets bottle guy come to a location where he drops the bottles off, and then you can send one of your employees who you do control out there to wipe down the bottles and then bring them in and put them where they need to be. So a little extra work, yes, but remember, we're trying to get to the end of this situation. This is not going to be something that we have to do forever. So in creating these drive-up services, it's like we look at those vendors, visitors, subcontractors, people that come and supply our businesses, whether it bring us material and equipment to a yard, whether it be bringing supplies into an office space, whatever that is that let's think about drive-up services. But let's also think about how we reorganize our common areas inside the workplace, our storage, copy rooms, supply stations, file areas. And I'm going to refer to file areas in just a minute. But the next phase that we go into is administrative controls. Now, we have this work from home. And again, I can't encourage this enough. We need to now put some policies into place, and we can help you with that, about what does it take to work from home. There are software systems out there to track time. There's to productivity. There's different ways for us to do this. And then we can stagger shifts. Now, in the staggering of shifts, excuse me, in staggering shifts, They're don't think of it as the day shift, night shift, and graveyard shift. If you have a policy where you're going to monitor your employees coming in and out of the workplace, then it's very difficult. Excuse me for a minute. Excuse me, I still work in an office environment. The staggering the shifts is this, is that if you have a medical plan where you're going to bring people in and you're going to check their temperatures, you're going to ask them the important questions that you should be asking them. How do you feel today? Have you been exposed to anybody who's had that tested positive with COVID-19? Do you have somebody at home that you're trying to assist that is COVID-19 positive? Have you been into any large parties? Have you been to any large gatherings? Let me take your temperature. Well, if you have an office of 40 people and you bring everybody in at 7 o'clock in the morning, that means you have to stack 40 people outside and go through that exercise as everybody's clustered together outside waiting to get in. So a stagger shift might be that we bring in a manageable group of people at 7, another one at 7:30, 8 o'clock. Now it means that we don't get to come in whenever we feel like it. We need to stay to some type of schedule. But if your business allows you to do that, I would suggest you stagger it that way. If you have a business where your employees come in, it's a service industry, and they come in to collect parts or equipment, whatever it is that they need to come in and pick up. If traditionally we bring everybody in the morning at 7 o'clock, then we develop these congested areas where everybody's mingling together, trying to get their equipment together so they can go out on the project site. Think of it this way: is if you bring in one group at 7 o'clock in the morning and they stock up for the next 8 hours and they go off and they do their job, the person that comes in at noon still comes in and grabs their 8 hours. It's just they have 8 hours worth of supplies for their afternoon and their next morning. And so it's about how can we stagger shifts. It's about being creative and thinking how we do this and making sure that we don't cluster people up. We're finding this in large construction sites where there's multiple contractors and we have 70, 80, 90, 100 people on a construction site, that if the construction start time is 6 o'clock or 7 o'clock in the morning, whatever it happens to be, we now end up with 100 people standing at the gate trying to make their way through, and it's creating way more problems than it's creating solutions. So we look at how do we stagger those shifts. We need to develop alternate meeting and work environments. That's what we're doing right now in the Zoom meeting. Travel restrictions are this: we eliminate or reduce the amount of things such as on-site sales visits. We start looking at no-touch services or no-contact services, no-contact estimating, whatever it is that we did before, where we were in direct contact with the customer. We now rethink that about how do we drive them to a website to show them samples without in trying nail those things down instead of sitting in their living room showing them samples. And then the transportation of people. So I get this a lot, especially in the landscaping industry. They say, well, we have 6 people. They work in a crew. There's 6 people that fit in a truck. So we put 6 people in a truck and we send them off to the job site. Does that mean I need to go out and buy 6 trucks? No. It means you need to be smart on how we do this. So maybe we put a policy in place that says that we only put 4 people in a truck. But if you are going to put 6 people in a truck, the truck has to be wiped down before they use it, has to be wiped down every time it's used. Everybody has to be in a mask and gloves. Everybody has to be something before they get into the truck. And then there's a trust element. If you're going to put everybody in a truck, make sure that you use the form. And if you have the pandemic response plan that we pass out, it's on page, I think, 16. There's a form in there, questions that you should ask them. And you have to ask these people every single day and be consistent about it. How do you feel? Take their temperature. If you have somebody that's questionable, they don't get in the truck. It's about common sense. But and we need to find creative ways to get through it. So we also need to establish emergency communication systems. That is, how do people report to you that they're COVID-19 or that they're COVID-19 positive? Now, if somebody calls in from home and they say, I've got the flu, I don't feel good today, your normal sick policy comes into play. It just comes into play. Nothing's changed. This is the flu. It's your sick policy. Sick time policy is your sick time policy. If they are at work and you take their temperature, and you think they're questionable and you send them home, that's a different situation. Now you're in something that looks like it might be in a workman's comp arena. It is something that depending on how it turns out, it could be a recordable incident in your OSHA 300 logs. If the person goes to the hospital and they are now admitted and there's some evidence that they contracted the COVID-19 from the workplace or as a result of you sending them home, then that becomes reportable. So there's a lot of things that come into play. And so I encourage people this. It's oftentimes we say, listen, if you have any problems with COVID-19, call the HR manager. I feel sorry for a lot of the HR managers because they call me and they say, I don't know what to tell them. I don't know what to say. What are we supposed to tell our employees? What is the HIPAA law? How does this all fit into play? Well, that's something that we are here for to help you out with, is that we will help you write out what it is that you should tell your employees. We help you with the system of answering the questions we have, and you'll see this on the final slide. We have an email address called covid19@traidenglobal.com, and it's a place where people can write in and ask questions. It's kind of a hotline. It can be a whistleblower. It can be whatever it wants to be, but somewhere, if you're going to reduce the amount of anxiety in your workforce and give them the right information, sometimes sending them off to a third party to answer those questions is a good way to do it. Okay, then we need to redesign the workflow. Now, this is incredibly important. Now, we talked about Charlie, the guy that brings in the water bottles, and how he moves through the facility and how he does what he does. Now, you can take your evacuation map that you have of your facility, and you should have one. If you don't, that's a different conversation. If you have an office and you have a yard, that evacuation map is supposed to cover your entire property boundary. So it's from any place inside your property boundary. If you're a construction site, it's anything inside the boundaries of your construction site you need to have on your evacuation map. So you take that evacuation map and you can start drawing just kind of a line item. Where do the people that work in the cubicle area, how do they come into the building? How does everybody get to their office? How do people get to the copy machine? How do people get to everywhere? And then you can look at that and say, well, how much mixture do we have and what can we do that's going to change it? Now, when they talk about social distancing, the rule of thumb here is that you really need to be in proximity of somebody who's contaminated for a period of about 10 minutes or more. So casually walking by somebody within 6 feet is not something that is going to create an environment where you're now a victim of the COVID-19. It doesn't work that way, but we want to minimize congestion. We want to make sure the workflow is correct. But we also might find out that, you know what, 90% of the people that come in here come in through the same door, past the same receptions, go to the same room to clock in, go to the same room to drop off lunch, and then pass the same areas to go to their workstation. Well, that workflow path becomes a path of potential harm and danger. And it's part of the hazards we need to control. So it may mean that if we have a receptionist in the lobby, that we need to cage her up in the lobby. We need to put some type of barricade around him or her that is the receptionist in the lobby to protect them from the fact that 50 people pass by her desk every single day or his desk every single day. And what does it take for us to make sure that that employee is protected? Or we reroute things. What I find with a lot of people is that they have designated an area closer to the door where people can check in, where if there's a medical check requirement, which in, for example, some areas, some counties, I'm not sure where you are, but I have a large client in LA, and LA County has made that mandatory that everybody does medical checks in certain types of industries. And I'm sure it's the same way. And I had a client I have in Indianapolis, same thing. It's mandatory everybody be medically checked going in and out of this facility. It's a medical facility, and it makes sense. But you need to find a place to do that, and don't make it right in the center of your office space. So, and then you need to train the person on how to do that. So we redirect the workflows. Then we develop policies and procedures. And I'm going to explain to you in just a moment how important that is. But once we've done all of this, now we have to tell people this is what we're doing. Now, this sounds arduous and it sounds daunting, and it's not. You've been doing this in your career for a long period of time. It's just now we have a specific topic we need to do this on. So, but the next step that we have is we need to develop and implement a training matrix or training system. Now, let me explain something about training. if you're a supervisor, you're a manager, or you're the competent person, or you or whoever you are inside your business, and you gather the troops together, and you say, from now on, everybody is going to come in the south door, and you're going to stop at the first desk and be checked before you're allowed in. That's a verbal training. What you need to do is record the fact that you told people that. We do that by collecting that information up in policies and procedures. So it works. We have three items. We have a policy and a procedure. We write it down because it's about creating defensible space. If you don't create defensible space, you can't defend your decisions that you have down the road. And this isn't just for COVID-19, it's for everything. We do a lot in OSHA investigations. We do a lot in OSHA appeals. And where we always have the most difficult time in defending clients against OSHA's violations is the fact that they don't have the proper documentation. They don't have a plan or a program. That right there, OSHA has what they call, for example, the good employer clause, which says that if you have the proper plan in place, which you're required to have, which is in some place, it's an injury and illness prevention plan. That's the IIPP. In other places, it's called the workplace emergency plan. They call them all different names in different areas, but it is your basic safety plan that covers the 8 requirements about who's responsible, what's your expectations, how do you do hazardous communication, how do you do accident investigations, all of those pieces. If you don't have a plan like that in place right now and you have an OSHA visit, number one, if they cite you at serious or willful serious, if you don't have a plan in place, you can't negotiate that citation level down. If there's a fine, you cannot negotiate the fine down. So you get an automatic 30% reduction if you have the plans in place, the regulatory requirements in place. Outside of that, you lose your abilities within the appeal process if you don't have these policies and procedures in place. I can't stress it enough. So we get policies, we have procedures into place, then we have to train it, and then we show competency by the fact that people are doing this in the workplace, or we have to record it, which means that we have proof that they understand the information that we've given them and that we've recorded it down in a signature. Now, a couple of things about that. I don't want to get too sidetracked, but there's a way that you do that. If you have a roster and you say put a check mark next to your name, that is not a record, because there's no telling if the person above or below them accidentally checked the wrong box. It's not the way that you do it. So there needs to be some indicator that you say that you use that says that it's an employee number, it's the last 4 digits of a cell phone, it's the last 2 digits of a social security number. It's something that's an identifier that you've given that training. But back to the training methods. We can do it verbally, we can do it in a 1-page, we can do it in an email, we can do it in a poster, we can do it with somebody in front of a class, we can do it in a learning management system, which at Traiden, we have a learning management system to help you out if you need it. There's a lot of different ways that we do training. The important thing is the training has to be tied to a policy or a procedure. It has to have some measure that says that the employee has seen it or read it, which means that they sign at the end of it. If you're using a code of safe practice, every employee should have signed that, those types of things. So what we're training on them is COVID-19 awareness training, not the wash your hands and sneeze in your sleeve. It's the COVID-19 awareness training that you have established inside of your facility. And I'm going to show you how to do that in the next slides. Management and supervisor response. You need to train your managers and supervisors how to respond to this COVID-19 issue, how to respond to an actual event, a case that a subcontractor who now has just notified you that they have people who are COVID-19 positive and they've been working in around your people. What do you do with that? They need to be able to talk people off the shelf, that people are panicked. We had a situation, a company of 250 people. One person tested positive to COVID-19. They work in an enclosed office in a remote area, not even around anybody else. And the next day, 250 people didn't come to work. We need to be able to manage that. This is what it's all about in this moving into the next phases. And we can help you with those. Your employee actions. What's your expectations of your employees at work and off-site? Now, under the general duty clause, if you're responsible for everything that happens on your workplace, safety and security-wise, you own that footprint. And your employees complying with what you ask them to do during this COVID is a condition of employment. So if you tell them to put on a mask, they don't get the option of coming in without a mask. If you tell them to wash their hands every 30 minutes, they don't get the option of not washing their hands every 30 minutes. You have conditions of employment that are what are the tools that you use to stay compliant under the general duty clause, and so you own that. I get this a lot from employees. They say, well, you know, my weekend, my time off is my time off. If I want to go to a party or I want to go play soccer, I want to go hang at the beach, I want to do whatever I want to do, that's my time off. They can't control it. That's true. That's true. But they can control whether you come back to work. So that equal opportunity and ADA all changed on March 20th when they declared this a pandemic event. It gave you controls that you don't normally have in your business about who can come in and who can't come in. You are the gatekeeper to your footprint. And so we just let the employees know that, listen, that type of action is not responsible action. If we find out that you come back and you start telling people, yeah, I partied with all my buddies all weekend, we had a great time, then you have the right to say, listen, we're going to take a little 72-hour check and make sure you're not symptomatic, or we can take some level of response against that. So, and then the rest of it is, if we're going to change business operations, workspace, workflow, anything that we're going to change, it needs to be included in the training so people understand what it is. You can't defend it if you don't tell them how to do it. Now, respiratory protection, this is a big question I get quite often. We hear the term the N95 mask all the time. N95 means that given a certain type of particulate that mask was designed for, it will block out 95% of the particulate from entering the body. That's what N95 stands for. N95 is not a mask, it's a respirator. N95 requires a fit test. There's multiple sizes. If you wear an N95 mask, you can't have facial hair. So there's a lot of requirements, and that falls under the respirator protection clause, which is regulated by OSHA, and they will enforce this. Now, it doesn't mean you can't use an N95 mask. Here's where it comes into play, is that if you say it's mandatory to wear a mask, and it's mandatory that you wear the mask that I give you, and you give them an N95 mask, then you need to fill out what's called Appendix C out of the regulation, which is a medical questionnaire. They need to be clean shaven, and there need to be a fit test, because the N95 masks come in multiple sizes, and they come in multiple sizes based on facial configuration and other things, and you are fit tested with that respirator. So now, if you say everybody needs to wear a mask when they come to work, a face, it can be a cloth covering, it can be anything you want. We have N95 mask here, you're welcome to use them if you are, but it's not mandatory. That's Appendix D, and they sign Appendix D out of the regulation, and that is a waiver that says that they understand that they are not being fit tested for this N95 mask. So the best policy that you can have is say, we have masks that are required. They can be cloth masks. They have to cover your nose and your mouth. They have to be made of a quality that looks like it's providing respiratory protection. And we have masks available. If you choose to use an N95 mask, that's completely up to you. If you're going to supply the N95, have everybody fill out the Appendix D and sign it. Now, if your industry requires you to wear the N95 mask, then you are required to fulfill the regulations in OSHA, the respiratory protection regulations and standards that are there, you have to follow them. So personal hygiene stations, hand protection, face shields, all of these things, clothing, these are all personal protection. Also, remember that if we're going to put a barricade up around the receptionist who everybody walks by, then that is also personal protective equipment for that particular individual. So we see that a lot now, where people are putting shields around like cash registers and those types of things. It's going to be that way for a while until we get all of this under control. So what do we do with this? This is step one. Now, for those of you that might have been through the response webinar I did before, this is going to look a little bit familiar, but I want you to do these 5 things. And this is important. And it's not difficult to do, but it's going to give you a great start. And it's actually going to probably begin a culture inside your facility of how you address all hazards that you may come up against, hazards you have now or hazards you may have in the future. But I want you to assemble a management action team. Now, the management action team is not the management action team you probably are thinking about. It's not the owner and the superintendent. Your management action team is anybody who's going to help you manage the actions necessary to prevent the spread of COVID-19 in your workplace, and to help you comply so that you don't find yourself out of compliance and kicked out of the phase one return to work. So the management action team could include, for example, somebody out of maintenance. Maybe they're not a supervisor, but they understand how maintenance works. Or it could be somebody in the storage area, somebody who runs the filing system, or somebody who dispatches. But it's also your insurance agent. It's your accountant. It's your banker. It's your lawyer. It's me. It's somebody that can help you through the safety side of these things. These all become part of your management action team. Then you divide, and you may find that as we divide your company into sections, that some of those sections are being controlled by a subcontractor. For example, if you have somebody that does all your building maintenance, they may be part of your management action team. So you're going to divide the company into manageable sections. Now, one manageable section might be all the business infrastructure, which would be your insurance, accounting, legal systems, those types of things. That might be one group. It may be your accounts payable and receivable. It might be somebody who controls storage areas or a warehouse, or somebody who controls maintenance, or somebody who controls dispatching, or somebody who controls whatever it is, or people in the field, or different types of crews in the field. And we're going to divide the company into these small manageable sections. Now, we may find that when we assign these sections to the management action team members, that there are some that naturally we pull them together. But we need to look at those individually, because we're going to do something very important. We're going to develop a procedure and a policy for each one of those small little sections. So if you determine that one of your section is the stay at home, work from home group, then you're going to assign some management action team member to oversee not the workers that are working from home, but the process of how they work from home. And we're going to put together a procedure and a policy. Now, when I say simple, I'm a technical writer. I've been writing technical documents my entire life. I know where to put the logo, how to format everything. That's not what I'm talking about here. Getting an 8.5 by 11 sheet of paper and a crayon. I don't care what you use, but write something down, because you have to start something in this process that you can defend down the line. You may find you're defending it legally from a workman's comp issue. You're defending it in why you're still open, why you're staying in business, why you're part of an essential service, why you're doing whatever you're doing. But you need to start capturing these things in even notes that you put like in a construction log, or things that you put in a journal, or things that are admissible in a court that you can defend later on. But you got to put something in writing, which starts the process of the written policy, the training, the competency, and now you've covered yourself from a defensible position. So once we've developed these procedures and policies, then we begin the planning and implementation. So 14 days out, which we're going to assume everybody right now is 14 days out. Determine the needs of each of the sections based on the hierarchy of control. So take those component parts: elimination, substitution, engineering controls, administrative controls, and PPE. And for each one of those sections, see what you can do to reduce the chance or the probability or the consequence of a COVID-19 situation in your workplace based on the hierarchy of controls. If it's nothing, just throw a check next to it. No big deal. It's not applicable. But if it is applicable, then that's something that you're going to start putting into place, and it's going to help you as you move through your 14-day out. Then determine who will be introduced back into the workforce in the order in which they'll return. So build a matrix and say, well, the first we're going to have, first group we're going to bring back is the managers, so we can establish a management action team, establish policies and procedures. These are things you can do right now. And even if you've still continued working through this process, you need to capture what you've done before you're in a regulatory situation or an inquiry, or you have to defend yourself or explain yourself or do any of these things come forward. The time now is to capture everything that you've done to adjust yourself to continue to work as an essential service. Whether you've worked fully or partly or whatever it is, it's time for you to now collect all of that information and start putting it into something that makes sense. Then we build this matrix about who can be introduced back in to the workforce in the order in which they'll come back. You're going to want to ensure that the property is ready to start up for employees. This is 14 days out. Now, This does not mean that you have the property ready to receive visitors, vendors, and subcontractors. You're trying to get this thing ready to make sure your employees are set. Now, maybe you're pretty close to set because you've used your office space throughout this, but maybe you haven't, or maybe it's been partial. But before you can bring back anybody else that's not somebody under your control, like an employee, somebody who's not controlled by your policies and procedures, like visitors, vendors, subcontractors, suppliers, you have to make sure the property is ready for you to operate. At that point, then you can determine in the next phase when it's okay to start bringing other people in, because you've already trained people on workflows, workspace, drive up services, how all of that's going to work and how you're going to function. So this 14 days out is a good time for us to look at workspace, workflows. Even though your business is shut down, if you are one of the ones where they said shut down, you need to close, you still have the opportunity to go back in. You have assets inside your place of employment. You still have the ability to go back into there to make sure that your area is secure. It's going to be on a case-by-case basis. But as long as you're not doing work in there, you're just trying to make sure that you're maintaining the building or getting it prepared for your employees. Just don't send everybody back in. It's the other reason we don't send everybody back in 8 o'clock on Monday morning, because you create confusion and chaos in trying to reestablish how you're going to do this. And you're going to find yourself cross-contaminated and starting back at zero. But 14 days out, this is when we get building utilities and maintenance workers and IT personnel, all the people that need to go back in the facility and look for any gremlins that might have raised their ugly head over the last 2 months. And we need to make sure that we are ready to work in the new normal. Again, maybe you've been doing this all along. It's time for you to formalize the process of the new normal. If you're going to implement a formalized respiratory policy, then this is the time for you to do that. And what I'm talking about that is that if you're going to insist on N95 masks, or you're going to have, but you know, a informalized policy is you say everybody wears a mask when they come inside. If you're in a hard wall office, you can take your mask off. If your door's open, your mask is on. Or you make the statement, everybody stays in a mask for the next 14 days and we'll see how this goes. Whatever that is, that's an informal policy. But a formal policy means that you're now going to do something within the regulatory realm of OSHA. What you're going to end up after you've done all this is you're going to end up with a couple of different phases. You can say, and these are examples. So, for example, phase one, after 14 days when they say it's okay to open up, is the first 2 to 5 days is we're going to introduce upper management, mid-level management. We're going to continue to telecommute from home, but we're going to build a training system. We're going to get our IT, our cloud system built up. We're going to get software systems put into place. We're going to do all these things, but you start developing these phases that tell you and these are strategies, and then below these are tactics. It's how we're going to do that. So, for example, in bullet number 3, we're going to enforce and train returning personnel in new respiratory policies and procedures. So that is a strategy. That's what you're going to do. The tactic might be that is we need to write out a simple policy, or we need to adopt the OSHA 1910 policy. We need to put a training matrix together. We need to make sure everybody gets trained. We need to make sure everybody's signed off. And once that's okay, then we can bring them back in. So those are the tactics that go underneath that. So you'll build a couple of these different phases. Now, we've done these before. We've done these a lot, not just in pandemic events. We've traveled to 40 different countries, helping people set up where there are no emergency management systems, where there are no fire departments or police departments, and they still have huge hazards. One of the things that we've done that's very successful, and it seems pretty simple to me, is that somebody gets out a pad of paper and we say, well, let's start here. What are the 5 things we want them to do? And you write down 1 through 5. Is there anything else? No. Well, maybe there's 10. And somewhere down the line, you're going to find that 5 should have been 7, 7 should have been 5, 4 doesn't make any sense at all. But as you're developing these strategies, write a strategy up on a board, write it on a wall, write it on, and take a yellow sticky note and start taking tactics and saying, well, if they need to do this, they need to know this and this and this and this, and just start building out something that looks like it makes sense. It's the new modernized spitballing, where we start putting tags all over the place about this is what we think we ought to do. Don't make it difficult. Don't get locked in the weeds. Keep it at the big picture item. When your employees come back in, they'll help you fine tune it by saying, hey boss, you know what, this doesn't work well. or, hey, boss, I can't get my job done if you want me to do this. And they'll help you refine the policies and procedures that you're writing out. So, risk management programs. This is what we do. We've been doing this for a lot of years. Like I said, I started back in 1974 in the petrochemical industry. I've been around 40 countries doing this. I've been in some of the most horrific situations and conditions that you could possibly imagine. But I learned early on, my second day on the job at the Chevron refinery, is they put me in the fire brigade, and they taught me how to fight fires. And then it wasn't too long after that they made me the incident commander, and I was now out there controlling emergency incidents and controlling fire teams. And then I taught at the University of Nevada, Reno, in their Fire Science Academy in the petrochemical industry and mining industry. And I became a bit of an expert at, if there is such a thing, at putting out petroleum fires and mine accidents. I've traveled around for all of these different things. And what I've realized is that your safety program and your security program are directly related to your emergency management program, which is your fire and security or whatever it happens to be. So emergency management is what we do when our safety and security expectations fail. And that's what's happening here. We weren't prepared for this COVID, so our safety and security expectations failed us from a lack of preparation. So during the response phase, we're right smack in the middle of emergency management. Now it's time for us to start into business continuity, which is recovery. So emergency management is what we do when safety and security fail. Business continuity is the process that we use to get ourselves back to a sense of normalcy as quickly as possible and get our businesses up and running. I want you to look at the chart on the left. This chart on the left is a chart that I've used for years. And these are all the things that every business, I don't care how big you are, how small you are, where you're located, what your structure is, all of these things affect you. All of them do. So, for example, in natural disasters, we find that at hurricane season, which we have an office in New Orleans, so we are very familiar with hurricanes and situations down there, is that whenever there is the aftermath of a hurricane is they establish this veil of martial law, which says that they isolate areas that they haven't been able to inspect yet. And so those areas that haven't been inspected yet, nobody gets to go in. Well, if you don't have a plan ahead of time of how to deal with the fact that you don't get to your office for the next 4 weeks, we've got problems. So some of these things are going to require a plan, a program, a training system, and some of these things are just going to require a conversation. So, but everything that you see under this plan to stay in business is something that you should deal with. And so our business impact analysis, we look at the probability that any of these things could occur, the consequence to your business if they do. You start developing the strategy and the tactic behind it using the hierarchy of controls. And that's how we build safety programs. Sounds simple, doesn't it? It can be a daunting task, but listen, you are part of a system under Jeff Bellinger and the Better Business programs that you have access to this. And so let me tell you a little bit about what we do. So under the COVID-19 recovery plan, we can help you fulfill your responsibilities under the general duty clause. We can help you with the restructuring your business operations. We can help you with your return to work policies. We can help you writing policies and procedures. A lot of things that we can help you do. Now, what we typically do is that you have a process by which you can go to the portal and you can ask a question. And the way that if you've never used that portal, this is how it works, is that everybody has the opportunity to ask any question that they want, and we will give you an answer. I have a membership program, which I'll show you in a minute, but being a part of that membership program does not determine whether you can ask me a question or not. You get that because you're part of the insurance program that you're a part of right now in the portal that you have. But we can help you out. So typically the way it works is that if you call and ask us a question, if we can't answer it in a reasonable length of time, and trust me, most questions we can answer in about 5 minutes, or we'll send you a link to something or send you a document that helps you out. Then it goes to a project. And when it goes to a project, we'll establish what the work scope is. So something that's going to take us hours to do or a couple of days, or we may be in it for the long haul with you over months. And trust me, a lot of them go to that level. Then we'll work that out. But for right now, what we're doing is that all of those things that we're providing, we have a membership program, and we've tried to make this as inexpensive as we possibly can. But I still have people that I need to staff up to maintain this. But we do the same personal assistance or one-on-one calling or one-on-one coaching. Now, again, you get that phone call anyways. We do weekly webinars. We have instructional video trainings. We have the pandemic response plan. But actually, Jeff, I think you have that pandemic response plan as well. If not, I'll make sure you get a copy of it. The membership site, we have all these different things, but mainly what you get is kind of this peace of mind knowing that you have a group of experts, and we have people in, we actually have people in the Iowa area, New Orleans on the East Coast, North Carolina, along the West Coast, Gulf Coast region. We have people all around that can help out. And we have all different levels of expertise. A lot of us have been in this business for 35, 40 years or more. So how do you get a hold of us? There's two ways to get a hold of us. You get a hold of us through the portal, and that's a good way to do it. But that access to us through the portal is not 24 hours a day. And so I tell people this, listen, you are part of a system that I'm a part of. And this is a commitment that I've made to everybody throughout my entire career since 1994 when we started this Traiden Global Solutions. If somebody wakes you up with an emergency in the middle of the night and you're part of my group, then my expectations you wake me up too. So we answer the phone 24 hours a day, and I have done that. I've answered the phone if refinery explosions at 3 o'clock in the morning and mine collapses at 1 o'clock in the morning. I answer the phone as often as possible. If not, somebody's going to get back to you in a very short period of time, so please leave a message. You can reach us by going to either, if it's COVID related, go to the COVID-19 at traidenglobal.com. Send us an email. You can send us an email request at solutions for all other issues at solutions@traidenglobal.com, and we'll respond to that. If you are interested in the program we have, you can go to the COVID-19 recoveryplan.com. But for the most part, I want you to be fully aware that under the group that you are signed up with is that you have access to everything that you need to get to the other side. My only issue is that if you don't call me, I can't help you. If you don't email me, I don't know that you need help. So